Hey everybody, and welcome to the Optimove podcast. Today's episode is actually a replay of our most popular podcast to date. Since first releasing it, the feedback has been overwhelming. Lots of people found it tremendously helpful, including our clients. They said that after listening to this episode, they had a better understanding of why it was important to do the things that they were doing to get better, and so they were able to execute on our plan a lot better. It covers a problem that affects nearly everybody of all ages and physical abilities, and that's weakness of the hip muscles. Here are just some of the problems that weakness of the hip muscles can cause: knee problems, back problems, sports performance problems, IT band problems, general glute problems, balance problems, falling, the necessity for canes and walkers, and SI joint problems. Weakness of the hip muscles affects everybody and should be taken seriously. Thankfully, there's a ton of great information in this episode about what you need to know to be prepared to deal with it. I hope you enjoy it.
Today on the Optimove podcast, we're going to talk about one of the most underused and underappreciated muscles in the body that affects everybody of all populations, no matter your age, physical abilities, or what you aspire to do physically. No matter who you are, this will affect you. My name is Dr. Jeffrey Guild, physical therapist and strength and conditioning professional. Every day we strive to empower people to achieve their optimal movement so they can fully engage in their life again. All right, today we're going to talk about a problem that affects everybody of all ages and all physical abilities, and it's the weakness of the hip muscles. And you can think of this as basically the muscle on the edge of your glute or the side of your rear end. This is the side rear end muscle. More specifically, you can think of these as the glute medius and glute minimus if you want to get really detailed on it, or if you're a healthcare provider and you know your anatomy. So you can think of it as hip strength, basically. So this is a very, very common problem amongst all people of all populations, elite athletes, general public, older people with or without hip replacements. It doesn't matter. This problem affects nearly everybody, and it's one of the most under-recognized problems both in healthcare and in the fitness world, and even more problematically, the problem of how to fix it. And usually people try to fix it, but they do it in ways that actually feeds into the problem more and more. And we're going to talk about that today and how to fix that problem. So hip weakness, very, very common problem among runners, cyclists, and athletes who do a lot of front to back motion. So they run, their legs go forward and they go backward. They cycle, their legs go forward and backward. They're doing the same repetitive movement all day, every day. For older individuals, it's just a motion that people don't do very often throughout their lives. And as people get older, it tends to become weak. So the motion is basically more side-to-side movement, right? So that's why people who do a lot of repetitive front-to-back movement, runners, cyclists, things like that, people who walk a lot, develop weakness in their hips because they're not doing enough side-to-side movement. They're not doing enough exercises that work moving their leg to the side or stabilizing on one leg, maybe not enough, in the strength conditioning world, we call it single leg movements. Or if they're doing single leg movements, they're throwing in additional compensation strategies. And we're going to talk about how to prevent those today. So, if you're an elite athlete, you're doing a lot of repetitive movements, this is likely a problem for you. If you've had surgeries on your hips or your knees at all, oftentimes hip weakness is a problem. Whether the surgery was done directly on the hips or not, a lot of times just because someone has a surgery on their knee or their foot, they may not use that leg for a while, and then as a result, a weakness develops all the way up into the hip, and this causes a ton of problems all the way down towards the foot and then all the way up the back as well. So if you know someone who's had surgery, or if you know an older person who's had a hip replacement, you might see this problem a lot. And as I point these things out to you, you're going to start thinking about people that you know, or you might be thinking about yourself, or you'll say, oh yeah, I've seen that before, or oh yeah, my mom has that problem, or yeah, I see people do that in the gym all the time, and so I see where that's happening, where that's coming from. So very, very common problem. So the problem with hip weakness is that it often causes problems directly on the knees. And this is because the hips basically stabilize the knees really well. And we don't often think of it too often, but you'll often see people when they're running, when they're walking, or standing up out of a chair, their legs turn in. Now, this can be caused by a number of different things, but a very, very common problem is basically hip weakness. They don't have that torque from their side glute muscle, their side rear end muscle to pull their knee outwards, or they're just not firing the muscle. So the strength might be there, but they might not their body may not be actually utilizing that strength. And that's another common problem. So it's not always a weakness issue. It can be the body just doesn't want to utilize that muscle issue. So it can cause hip weakness, can cause knee problems. It can cause back problems because there's not enough stability in the hips and in the pelvis. And when that happens, you start developing problems in the back, and then also, of course, problems down towards the knee and to the ankles as well. But you get back pain and back problems from hip weakness because if the pelvis is not stable, then what's directly above the pelvis is the lower back. So then the lower back isn't stable, and then you start developing problems. And even the pelvic area itself can become problematic. So if you think of the pelvis as kind of a bowl, and one side of the bowl can rotate forward while the other rotates backward. And a lot of times people know this in the general public because it's such a common problem and it causes so much pain and so much people have to seek chiropractors and physical therapists and doctors for it. It's called the SI joint or the sacroiliac joint. That joint can get out of alignment quite easily if people don't have enough strength in their hips. Sometimes people can go months and years with this problem and they'll never notice it. They might just kind of notice that, when I stretch my hamstring, it goes longer on one side versus the other. They'll notice one difference between one side versus the other, but they don't get pain with it. All the way up to people having severe pain to the point where they're seeking back surgeries and they think they have quote unquote sciatica and all these things going on because they have radiating pain down their leg. So instability in the pelvic area can cause a lot of problems in the back and, of course, in the knees. So this is common in the general public, and we see this all the time. Amongst athletes, we often think of hip weakness causing knee problems because the hip doesn't stabilize the knee well enough. And so as a result, the strength conditioning world has put a lot of focus on stabilizing the hips or hip stability, working those side rear end muscles, doing more side to side movements and not just front to back, and also, of course, rotational movements as well. So your educated strength conditioning professionals will dedicate a lot of focus to hip strength with their athletes because it's well recognized that too many sports are just you go front to back because that's how we move oftentimes in daily life, and sports oftentimes are not much different other than maybe hockey and a couple of exceptions. So hip strength is a huge problem amongst athletes oftentimes. And of course, athletes are great compensators. They will find any way to move, however possible, to perform at a very, very high level, and their body will find a way to do it. If there's a will, there's a way with the athletes, and they will find a way to do it, of course, at the sacrifice of their bodies breaking down over time. And eventually they do break down if these things are not caught in advance and corrected. So these types of athletes then are more prone to injury, the great compensators. And hip weakness, of course, is a particular problem. So if you're an athlete and you're weak in your hips, you're more prone to having knee problems and possibly even foot and ankle problems and back problems as well because your pelvis is not stable. No different than the general public. You're also probably more likely to use other muscles to achieve everything you want to do other than your hips. So the muscles in the front of your leg, we often think of them as the hip flexor muscles, often get overly tight, and this can cause a lot of problems such as IT band problems. It can cause back problems. The IT band's a big tendon that runs from the side of your leg all the way down to your knee, which then causes knee problems as well. And the root cause oftentimes is the hip weakness, or the hip weakness is a big contributing factor to this problem. And of course, since the athlete is moving front to back, front to back, front to back, the muscles in the front of their legs are getting overly tight and then pulling their trunk forward or torquing on their pelvis. So then their pelvis then rotates back, which can cause back problems. And then when that happens, the muscles in the front of the legs start shutting down the glute muscles. And so then the glutes don't fire, and then you're resulting in hamstring problems. So you see how one thing leads to another, which leads to another, which leads to another. So these great compensators, these great athletes start developing tightnesses and weaknesses, but they still keep going. they still keep on and they perform at a very, very high level, putting their bodies through a lot of physical strain, and eventually something will break. The question, we just don't know what it will be. Will it be the hamstring? Will it be the knee? We just don't know what. Very rarely is it an injury to the hip itself. So the source of the pain is not usually the root cause of the problem. And this is particularly the case with the glute. We don't often see glute medius and glute minimus strains. We see it sometimes, but usually the problem of the weakness in that area causes problems in the knee and the back and other areas. So those are very, very common problems. Athletes tend to do a lot of cutting. They tend to do a lot of twisting with their knees. And because of that, they need a lot of stability in their knees. And if they're not getting it from their hips, then they're not getting it from anywhere else. Trust me, they need to be getting a lot of stability from their hips in order to do the high level things that they want to be able to do. Otherwise, something will break, whether it's the knee, the back, the SI joint or sacroiliac joint, something is going to give at some point. So this is particularly true amongst female athletes, because if you think about the way that your typical female is built compared to your typical male, the female pelvis tends to be wider, and the hip joint on the female pelvis is usually located out farther compared to the males. So there's usually an angle between the hip down to the knee. And so because of that, that creates a mechanical challenge with females and female athletes. So that's all the more reason to make sure that their hips are extremely, extremely strong, that they can have the strength to take on all the cutting and twisting of the knee that the athletes needs to do. And so the hip strength is a big part of that. There's other things as well, and you have to address those as well, such as inner thigh tightness, IT band tightness, and all the other things that can cause the knees to be unstable and rotate in and do all the things that you don't want a knee doing. Now, for a male athlete, there's a slight mechanical advantage from the standpoint that the hip, knee, and foot usually are structurally in alignment. And so you don't have that additional challenge of an angle between the hip down to the knee. Still very important for male athletes, hip strength, but there needs to be a special emphasis on hip strength for female athletes because of that reality. It's just the way that we are built. And again, a lot of great strength conditioning coaches are putting the emphasis on that, and especially with female athletes. So with our older population, we can see problems with hip weakness causing even walking problems and balance problems, and even to the point where an older person might need a cane or a walker. And oftentimes we'll see this in older populations because they're not moving as much as they used to, or they've lived life longer than the rest of us, and they've just they've raised kids, they've worked, maybe they exercise, but maybe not always in a quite structured way, or they haven't been trained by a Division I strength conditioning coach. So they're not thinking about training different planes of motion and, working muscles that can prevent injury and all these different things. A lot of athletes aren't getting that either. So in the general public, people tend to just live their lives. They might exercise, they might walk and do all these great things. But over the years, these muscles don't tend to get used a whole lot. The hip muscles don't get worked enough in general because we don't often move side to side. We're usually moving front to back. So what happens is through the years, people tend to develop these weaknesses in their hips. Sometimes on one side, sometimes on both sides. Now, if you start throwing in, broken bones, surgeries, and all these other things that people tend to experience throughout their life, knee scopes and knee replacements, hip replacements, and all these things, then you increase the risk of a hip becoming weak. And so then you get one hip that's very weak, and then the other that's not. So this tends to cause a lot of problems in the older population. So when older individuals have hip problems, it can also lead to falls. And that's because one leg is not stable enough compared to the other, or both legs are actually not as stable as they should be, and that can go unrecognized for a very, very long time. And basically the foundation is not as strong as it should be. So changing direction or being able to respond to changing direction isn't strong enough. Or the use of a cane or a walker can contribute to a falling problem. That's not to say that canes and walkers cause falls, but the fact that someone is having to use a cane or a walker at this point now then contributes to a falling problem because they needed to use it in the first place because they have a hip weakness problem. They may not know why they're not walking well, or they may not know why they're unstable, or they might not know why that they need to use a railing when they go up and down stairs, or why a cane just seems to help, but walking without a cane, they're just not as steady. And so the perception is that there's a balance problem when they don't realize that it might just be a hip weakness problem. Or of course, then one thing feeds into another, then you develop over time both a balance problem and a hip problem at the same time, or a hip weakness problem. So also very common to see older people, when they stand up from a chair, you might see that their knees kind of cave in. And we talked about this with athletes. So the knees going in is always a huge problem. You don't want the knees to fall in inward at any point for any population. And the older population is no different. So when they stand up from a chair or when they sit down from a chair, you might see that their knees turn in. This can be caused by a number of different problems, same as athletes, but hip weakness is a very, very common problem in the older population, again, because we don't move side to side very often. And when we do, there's a lot of compensations that can be thrown into the mix. So our hips tend to become weak over time. The older person may have had surgeries, joint replacements, all sorts of things that can make their hip weaker for one reason or another. What can also happen is the glute muscles or the rear end muscles themselves can start becoming weak. And this happens partly, yes, because of a lack of use, but it's also because of the compensations that begin to develop over the years. So as people move front to back, as they sit more and aren't walking and standing up as much, maybe they're not lying on their stomach as often, they start developing the tightness in the front of their legs. Again, back to these hip flexor muscles that we talked about previously. And these are very powerful muscles that go from your knee all the way up to about the level of your ribs. So it's a very long group of muscles, and it's several of them. And what they do is they basically help you bring the leg up when you're just standing and you lift your leg up. It also allows you to bend your trunk forward. And that's the movement that the hip flexors do. These muscles are very, very commonly become very, very tight. When they become tight, they tend to shut down the glute muscles, so the rear end muscles, whether it's the glute max or the glute medius and minimus, movements such as moving the hips forward, and then also stabilizing the pelvis and then moving your leg to the side. Those types of movements then are not optimized because the main muscles that do those sorts of movements then begin to shut down because the muscles in the front of the legs are tight. And so then the muscles in the back, the glute max and the glute medius and glute minimus, begin to shut down. And so then those muscles don't fire. And then when people go to stand up, they're not using their glutes also to help them stand up. On top of that, their quads might be getting weaker, so then their knees aren't able to straighten out as well. And then they're using their hamstrings too much in order to stand up. And then all sorts of compensations start developing. And so these are the types of compensations we want to prevent from happening. Again, whether it's an athlete, a 40-year-old in the general public, or an older person. So, and the weakness in the hips tends to also then lead to the hip flexors becoming tight, which then leads to further shutting down the glute muscles overall in general. What happens from there is, as an older person stands up, you might notice that they have problems standing up all the way. Their trunk is leaning forward. And this is a very, very common problem. It's not always the case that it's the tightness in the front of the legs, but it's very commonly a problem. And we know this because when we address the problem directly, we can fix this what seems to be a posture problem immediately or almost immediately. And It's incredible. But so you have an older person who's being told by their spouse or their children or whoever, mom, dad, stand up straight, stand up straight, stand up straight. And all you hear from them, I can't, I'm trying. And they are, because what's happening is the muscles in the front of their legs are pulling their trunk forward. So then they can't stand up all the way. And oftentimes the reason for this is tightness in the front of the legs, the hip flexor complex. That's not always the case. Sometimes it can be a back issue. Sometimes it can be something else, but a very large percentage of the time, it's simply the tightness in the front of the legs from those muscles. Part of the reason why those muscles get tight, repetitive front to back movement, too much sitting, and not enough activation of the glute muscles themselves. Because when you work the glute muscles and you work them correctly, then you actually start relaxing the muscles in the front of the leg because they feed into each other. So the muscles in the front of the leg, when they're tight, can shut down the glute muscles. The glute muscles, when they're activated, can cause the muscles in the front of the leg to lengthen out and relax. And all these things feed in together to a huge movement problem, where then an older person is not able to stand up all the way because their trunk is being pulled forward, and they can't control this unless if they're given something specific to correct it. On top of that, older people tend not to lie on their stomach as often for one reason or another. It's amazing what happens when with a proper professional, you get an older person to lie on their stomach, and of course make sure their airway is open and make sure that they don't have a back pain that's causing additional issues. But this is also why older people sometimes don't lie on their stomach very often, because then maybe their neck doesn't rotate to one side or the other very often, or maybe when they lie on their stomach, they get some pain in their back, achiness in the back. Is that okay? Is it not okay? And people then just tend to stay away from it. So as a result, the only motion that seems to be completely safe is sitting, truly. And as a result, the muscles in the front of the legs get tight, which then shuts down the glute muscles, including the side glute muscles. Okay, so moving back to then the side glute muscles themselves, those hip muscles that we're focusing on. If these muscles get weak, you can even have problems with walking. And so then people start using canes and walkers to help make up for that. And a lot of times people may not use a cane or a walker. And we see this all the time as well. So then movement problems will start to develop with walking. And it can even make the movement of walking even inefficient. So if you think about an air conditioner and how important it is to make an air conditioner efficient, right? So if it's more efficient in general, you use less energy. The human body is the exact same way. If you walk and your movement is efficient, you have a nice long stride going, the nice gentle arm swing. Each step is very similar than the other. You don't have one side being different from the other. You don't have to throw any additional compensations at all. You can walk for a very, very long time because your movement is efficient. Whereas if you have additional compensations going on because your hips are weak, so then maybe you have to bend your trunk to the side, or maybe one hip tends to just kind of move out to the side as you walk, whereas the other does not. These sorts of compensations can cause a lot of problems and make walking more inefficient. So then with older people, you tend to notice that they're not able to walk as far. They don't know why. And it can be difficult to figure out why. Why is mom and dad getting so short of breath when we're just walking down the street? Or, mom or dad can't walk as far as they used to, or grandma can't walk as far as she used to. And this can be caused by a lot of factors, but hip weakness is often a common problem, again, because anytime you have something that interferes with someone's walking mechanics and the walking becomes inefficient, and then there's an energy problem that then results because of the inefficiency of movement. So what happens then when you stabilize the hips? Then things start to correct, and then that person has a fighting chance to be able to do great things, such as walk farther, because that compensation strategy isn't there when they're walking. If you correct the hip weakness problem, then you might even be able to take the cane away, or you might be able to notice that walking distance starts improving, so that person can then walk farther, and then they can get out with their friends and family better, get out to the mall, get out to wherever they want to go, travel again, visit people again, because their walking is improved, so their energy level is improved, and their safety is improved because now their base is now stable as well. So all these things start to correct, all by focusing on the root cause of the movement problem. And it doesn't matter what the root cause of the movement problem is, as long as it's found and then figured out where that movement problem is causing problems somewhere else, and then somewhere else, and then somewhere else. And that's how you begin to problem solve through these things. And all these things are individual. So every single human is an individual. Every single human has a history, both a medical history, a movement history, a psychological history. All these things feed into how we move, even culturally. So different people in different cultures are instructed to sit in certain ways or stand in different ways or move in different ways. So all these things come into play when it comes to movement. So you have to really look at someone as an individual and not group them too much into a category. And so there can be patterns throughout these different categories. So oftentimes older people can have these sorts of problems, or an athlete can have these sorts of problems. But ultimately, it'll come down to the individual. It's important to look at each individual and all their different movement patterns and how they move in general, what's tight, what's weak, what's not moving properly. And then as we ask more about their past, we can get an idea of why that movement problem is there, or why they compensate in this way or that way. So let's get back to the side glute muscles, the hip muscles, however we want to think of them. So these are muscles basically on the side of your hip that go basically from the top of your big leg bone, the femur, up to connects to the pelvis. It's located on the side. There's two muscles, one on the outside, the glute medius, and then the one that's deeper into the body called the glute minimus. What they do is they move our leg to the side, and they also stabilize our pelvis when we're standing on one leg. That's mainly what they do. In my experience, very, very strong connection also to the glute max. What does the glute max do? It is the primary mover, the main mover when we move our hips forward. Too often for most people, over time, over the years, that glute max does less and less. It begins to shut down, and then the hamstring begins to do a lot more. Or they start using more of their quads to stand up, for instance, and straighten out their knees, rather than using their glute max to push their hips forward. So these are the compensations that tend to develop over time with a lot of people. So these glute medius and glute minimus muscles help to rotate our knees out or pull our knees out when we're standing up or sitting down. They stabilize our knees when we're on a single leg, such as when we're going up and down stairs. If you're exercising, you're doing step-ups, lunges, all these sorts of things, it's going to be that glute medius and minimus muscle that stabilizes that hip so that the knee, hip, and foot can stay in alignment. And if it doesn't, oftentimes that knee falls inward, and then we're putting more stress on the knees and increasing the risk of knee injuries. And of course, these side hip muscles also help to stabilize the spine, stabilize the pelvis in general, and then that way we're decreasing our risk of back pain and problems at the pelvis as well. So a big problem with these muscles is that they can be easily compensated for. So things like raising the leg out to the side or to stand on one leg, there are a lot of different muscles that can help us achieve those things regardless of whether the glute medius and glute minimus are doing their job. So the hip flexors, or the muscles in the front of our leg, can help to raise our leg out to the side, or our trunk muscles can actually lift up our pelvis to then raise the leg up, or put torque on the pelvis to then lift the leg out to the side. And these are all the different types of compensations we tend to see with people. As people compensate more and more, then the glute muscles shut down. So too do the glute medius and glute minimus. So then the main muscles that are supposed to be lifting the leg out to the side and also stabilizing our pelvis when we're on one leg are not doing their job. First, they stop firing, they stop doing the work, and eventually they can become weak. And that's what we're trying to prevent here. So Again, athletes are often great compensators. There's many ways that they can do all these things, whether it's from their hip flexors, from their trunk. There's another muscle in the back called the quadratus lumborum. It's located basically, goes from the pelvis up to the ribs. That muscle can also hike our pelvis up when we're lifting up our leg, or help us when we stand on one leg. And so all these different muscles can compensate, and then people will think that they have a back problem when actually maybe that quadratus lumborum muscle that goes from the back of the pelvis up to the back of the ribs is actually tight. So they're getting pain in their back, but really the main problem is that muscle is working too hard because the hip muscles are not doing enough. So let's talk more about some of these compensations that people do. And if you think about when you're in physical therapy, or if you're in rehab, if you go to the gym, you'll see people doing these side leg raise exercises, right? So they're lying on their side and they're lifting their leg up to the side. And what you'll usually see is the leg is moving forward. And not only is the leg moving forward, then their foot is rotating out. So their hips might even be bent at their hips. So they're kind of lying on their side at an angle instead of a nice straight line. And what's happening here is the hip flexors are very likely doing the work to lift up the leg to the side. And what that's doing is feeding into the compensation problem. So the hip flexors in the front of the leg are doing way too much work and becoming overly tight, overly dominant, and those then shut down the hip muscles further and the glute muscles further. And so the side leg raises then feed into the compensation problem. If you think about clams, so if you've been to rehab and they have you do that exercise where your knees are bent at a 45-degree angle, and you just simply lift your knee up while the feet stay together, right? Very, very cookie cutter common exercise in rehab. A very good exercise, and that's why it's a cookie cutter exercise. When applied properly, it's a phenomenal exercise. But easily, again, compensations begin to occur. People will rotate their hip backwards in order to lift their leg up, so they're not actually working the glute medius and glute minimus. They might be using their trunk muscles to lift up the leg. And they can even start recruiting their hip flexor muscles, even in that position, if the side glute muscles are not doing the work that they need to be. If you think about the gym, and if you see people doing kind of sidewalks, or they'll tie a band around their legs and then they're walking to the side with resistance, right, with the band around their leg, you'll easily find compensation problems in the gym in these situations. And what you'll find is people will hike up their hip when they're walking. They will bend their trunk side to side. They'll step out way too far, and then all these different things are done in order to walk sideways against resistance, probably with too much resistance, because their hip muscles are not doing the work. So what we really want in that case is for a smaller step out to the side. We want the feet to be pointed forward, and we don't want the hip to hike up at all. We don't want the trunk to bend sideways at all. And then we're making sure that we're staying very, very strict with how we're moving to the side to fire the side rear end muscles and not use all these other compensation strategies. In the gym, you'll also see when people are doing lunges or step ups and things like that, when they're doing lunges, you'll see that one hip will drop down compared to the other. And oftentimes, especially with younger people, it'll be on one side and not usually on both sides. Usually one side is weaker than the other. And so then one hip will drop down when they're doing their lunges. And they don't even notice it. So if you think about, you see your 20-year-old in the gym and, they're carrying a bunch of weight and they're doing lunges, and then one hip drops compared to the other. And what they might notice is that one leg might seem weaker on one side compared to the other. Or eventually they start getting achiness in one leg or a tweak in one leg, either in the hip or the knee somewhere, but they don't really know what's wrong. And this is a very, very common problem because you can see it. You just walk into any gym and you'll see the hip just sink with your younger individuals who are doing lunges in the gym. So back to our older population, again, this problem develops over the lifetime, and including the compensations also tend to develop. So older people have surgeries. They'll tend to have been hospitalized for one reason or another, illness or surgery or whatever it might be, falls. And so the hip muscles become weaker and weaker and weaker, on top of the fact that throughout life, people, again, don't move side to side very often. We don't stand on one leg very often. When we do, we may not do it properly. We'll start throwing in these compensation strategies to begin to be able to do these, to be able to get through exercises or to be able to do things in life. Compensations come in, and then the hip muscles get weaker and weaker over time. Older people also have they tend to have less strength overall to be able to make up for this weakness problem. So if they have weakness in the hip, they might also be developing weakness in the front of their legs and their quads. So now the strength to be able to straighten out their knees, the power to and force to be able to straighten out their knees and stand up from the chair is not what it used to be either. So then you have a problem of weakness in the hip, weakness in the quads, and there's less and less to compensate from. And that's why you'll start seeing an older person begin to use a cane or a walker, because there's nothing more to compensate with. Maybe their vestibular system, their central balance system, their inner ear balance system, whatever you want to call it, also is getting weaker as well. So back what we've talked about in previous episodes, the inner ear balance strength or the vestibular strength or our main balance system strength tends to go downhill as we get older because we just don't stimulate it as much, or for medical complexity or specific problems with the inner ear balance system, whatever it might be. A balance problem then also feeds into a hip weakness problem. So now the older person has less compensations to pull from. So then you have a multifactorial problem with the hip weakness contributing to all these other things. And so then all that everybody can see from the outside is that there's a balance problem or a walking problem or an endurance problem. So it shows up as all these other things. And so then the perception is, okay, well, mom's not doing as well as she was, or grandpa's not being able to walk as far as he used to. He's not walking the same. He grabs a cane here and there in order to be able to do things. He didn't used to do that. So all these things then feed into each other, and there's less to compensate from. And so what results is a true impact on the lives of older people and their families, because we're no longer able to pull strength reserves from somewhere else to make up for a hip weakness problem. Okay, so now let's talk about solutions for this problem. We've talked a lot about the problems that hip weakness tends to create and how that impacts people's lives and causes injuries and all these other things. So let's talk solutions. So the first thing you can do is when you're exercising, start throwing in side-to-side motions and not just front-to-back motions. So if you are a cyclist or a runner, make sure that you're including other forms of exercise such as rollerblading or swimming where there's side-to-side movement, or even getting into the gym and doing sideways lunges or sideways squats, doing sidestepping types of exercises, things like that. So if you're doing a lot of front to back movement, make sure you're also working side to side in some way as well. If you like to just walk and that's your main form of exercise, make sure you're including something else. Dancing is really, really good because it involves a lot of more side to side movement, sidestepping, things like that. Beginning to incorporate more side to side movement and not just front to back. Front to back tends to be our default as we're up and moving and walking as humans, but we need to incorporate the side-to-side motion as well. And then as you're doing these exercises to prevent these issues, make sure that you're very mindful of what you're doing, what muscles are doing the work, and what muscles and how the leg is moving or what is moving in general. So for instance, make sure that you can truly feel the work in the side of your rear end or your glute area. Work the side glute area. Make sure you're not feeling the exercise in the front of the leg or directly on the side of the leg. We want it more towards the back. Make sure you're not feeling it in your trunk, because the trunk muscles tend to help to lift up the leg and to help us stand on one leg. So all these different compensations, we can feel them. It's kind of like, mind-body connection. So we want to focus very closely on what muscles doing the work and how we're moving. The common compensations tend to be, again, the hip hiking, the hip rotating back, the foot rotating outward rather than staying straight ahead. These are all the common compensations no matter what exercise we're doing. The foot will turn out, the hip will will either hike up or rotate back. And so, or the trunk muscles will do the work. So we want to focus on all these things and make sure that we're doing it correctly, because if we're not doing the hip strengthening correctly, then we're easily feeding into the problem, and we continue to then compensate more and more. We're feeding into the problem rather than fixing the problem. So begin to view hip strengthening to prevent knee pain and foot problems and back problems and all of these other things. So we're not just strengthening the hip muscles to strengthen the hip muscles themselves. We're strengthening the hip muscles to prevent problems in other areas and to increase performance, whether it's an elite athlete that needs to be able to cut easily on the field or on the court or wherever it is, or if it's an older person that needs to be able to walk farther. The more efficient our movement is in general, the better we're going to be able to perform. We're going to be able to walk farther. We're going to get out with our friends and family better. We're going to be able to perform better on the field and do what we need to do as athletes better. Or if we're just an adult who wants to get out and still be physically active, by using the muscles properly, our performance will increase. And of course, that's always fun when we're able to do more and more. When we're seeing gains in our exercise, when our exercising is really showing results, we're able to do more and more, lift more, go farther, and then achieve things that we haven't done in perhaps a very, very long time, sometimes if ever. So again, avoiding compensation movements and then being very mindful of those. Of course, you can always go to a fitness professional or a physical therapist who is very educated on this area. If you're working with professionals who are very detailed, you probably have the right professional. So if they're getting very detailed on make sure this happens and not this and not this, and make sure you're using this muscle, that's the type of professional you want for a type of a problem like this. You want somebody who's noticing every little detail, because it can be difficult for us as individuals to see what our body is doing, or even to feel what our body is doing, or knowing what to look for. And you also want a professional who knows how to fix the problem, because this problem can be very, very difficult to fix. So when you have other muscles compensating, how do you then get some muscles to stop compensating and then to actually start working the muscles that need to be doing the work? I can tell you from here to activate your side rear end muscles or to activate your hip muscles, but that doesn't mean that you're going to be able to lie on your side and then lift up your leg and then just use the correct muscle. Sometimes there's tightnesses that need to be alleviated. Sometimes there's we need to work on just getting the muscle to fire properly, and that can be a little bit of a process. So working with the right professional can help you tremendously to achieve these goals that can, and again, this will amount to huge dividends in your life. If you have a hip weakness problem, it's going to cause a problem somewhere else or in multiple places and can result in a lot of problems in people's lives. So another thing to do is start where you are right now. Don't try to do exercises that are very complicated and difficult. And from what we've talked about today, you can see why. There's too many ways to compensate for these sorts of movement problems. It's too easy to hike up your hip. It's too easy to use the hip flexors. It's too easy to feed into the problem. So start simple, start basic, make sure you're using the correct muscle. Start where you are right now. Don't do something just because other people are doing it. Start where you are, and that's the best place to start. And of course, that's true with life and a lot anyway. So something else you can do, just stretch regularly, flexibility in general. You don't need to get too detailed with all this granular stuff that I'm talking about today. Just if you're stretching regularly and you're working on your flexibility, that's a great place to start. And of course, avoid sitting too much. So the more we sit, the more it tends to get the muscles in the front of the leg to over tighten, which then shuts down other muscles and prevents us from being able to stand up straight. And then that affects how well we're able to walk. It affects even how we look and how people perceive us, how well we stand upright. It makes a huge impact in life. So sitting too much and then not correcting for the tightnesses that result from sitting too much, no matter who you are, can be a big problem. So again, seek out a professional who can help you with this, and that's of course the best way to get started with it. Someone who knows what they're doing, whether they're a strength coach, personal trainer, physical therapist, somebody who knows how to look for movement problems that can guide you and coach you along the way and knows how to make the corrections. And so there's a lot of people who are just fascinated by this stuff. And I hope they're listening to this podcast because, this is a great place to start. Kind of get an overview picture of all these problems. And there's a lot of people that are just passionate about human movement, and then the things that can be done early on to prevent all sorts of injuries. Because, we've all been there. We've all had injuries, and the worst is having an injury that really impacts your life and you don't know why, and you can't figure it out. And it just keeps happening, and no matter what you do, it comes back, and there's no pattern, and you just can't seem to figure it out. That is extremely frustrating. That's how I got into all of this, because I became very, very frustrated with the shoulder problem that I had, that was preventing me from doing the things I wanted to do. So knowing how to fix these things is important when they break, but also how to prevent them from happening in the first place is the most powerful place to start. It requires the less work, less energy, less cost to prevent the problem in the first place. And once you get into it, it's actually quite enjoyable to think about these problems, these movement problems, and begin to prevent them from happening in advance. So the big takeaway here is you don't have to live with this. You don't have to let this problem affect your life. It's a very, very common problem for a lot of people, whether it's hip weakness in both hips or just one hip. It will result in problems down the line in some fashion. And so getting the hip weakness addressed is very, very important, whether you're working on by yourself or getting a professional to help you with it. Very, very important to address and fix. Doesn't matter how old you are. Doesn't matter your performance level. Hip weakness wreaks havoc all throughout the body, and very, very important to take care of these things. That way we're able to perform better, do the things we want to do both on the court and the field, be able to get out with family, to be able to prevent injury and go travel and do all the things we want to do, because all these things require actually a lot of hip strength. And if we don't have a good enough hip strength, then our base is basically taken out and we're not able to do the things eventually that we want to be able to do, because something's going to break or we're going to not have the balance we need. It's going to show up in one form or another. So I hope you enjoyed this episode of the podcast, and I'll look forward to seeing you on the next one.
Hey everybody, this is the producer, Anmar here. If you enjoyed this episode, please leave us a review. If you want to subscribe to the Optimove podcast, head to www.podcast.optimovedfw.com. That's where you'll find links to subscribe on Spotify, Apple Podcasts, or wherever you listen to podcasts. Once again, that's www.podcast.optimovedfw.com. To learn more about Optimove, our practice, go to www.optimovedfw.com. And lastly, if you're in the Dallas-Fort Worth area, give us a call at 214-712-8242. That's 214-712-8242. Thanks for listening, and we'll catch you in the next episode.